Tick, tick. So today we discuss about important topics, medicine. So medicine, first we start with cardiovascular system, then we discuss respiratory system, gastrointestinal tract, renal tract, and other conditions like orthopathy, etc. So the most important is cardiorespiratory system. So cardiovascular system, from the very beginning, we have to see the pulse. What are the different types of pulse? What are the different types of pulse reading? So let us start a simple topic today, pulse. Now, pulse means which in cardiovascular system is jugular venous pulse. JVP is very important. It is the right internal jugular vein. Is the best vein to accurate estimation of the central venous pressure. So, central venous pressure is by right jugular vein. Recording of jugular venous pulse is termed as flavogram. Flavogram, these waves in the normal JVP, what are the waves? So some, there are positive waves, there are negative waves. So A, C, V, A, C, V, these are the positive waves, and X and Y descent, the negative waves. So what causes these different types of EM, or what are their importance? So A wave means atrial contraction. Whenever there is atrial contraction in the JVP, we see the A wave. C wave is due to bulging of tricuspid valve into right atrium. Bulging of tricuspid valve into right atrium during right ventricular isovolumetric contraction और systole. ठीक है? So जब राइट वेंट्रिकल कंट्रैक्ट करेगा आइसोमेट्रिक मतलब दोनों valve उसका बंद रहेगा तो देयर इज बल्जिंग प्रेशर देगा तो अपर बल्जिंग होगा towards atrium and that causes C wave, a positive wave. Now what is V wave? V wave increasing volume of blood in the right atrium. Increase volume of blood in the right atrium during ventricular systole as the tricuspid valve closed. So tricuspid valve closed and there is increased flow of the blood in the right atrium. So there is CV wave. So these are the three positive waves. Now what is X descent? X descent means atrial relaxation. Atrial relaxation and downward displacement of tricuspid valve during ventricular systole. So atrial relaxation and downward displacement of the tricuspid valve. Now what is Y descent? It is the opening of tricuspid valve and rapid inflow of blood into the right ventricle. So there is open tricuspid valve and the blood rushes to the right ventricle from the right atrium. So this is Y Z. So these are the five waves A, C, and B. Now what are their importance? Now what are the abnormalities of JVP? So raised JVP with normal waveform, there may be fluid overload or right heart failure. Now raised JVP with absent pulsation. Pulsation absent, but there is JVP right. So superior vena cava obstruction, that is edema of the head and neck, and collection or collateral veins, and this absent venous pulsation. So absent venous pulsation, raised JVP in C. The most important is that what is giant or large A wave? Large A wave found in which condition? So large A wave found in tricuspid stenosis, pulmonary stenosis, hypertension, some cases of hypertrophy, that is known as Barhin effect. Now, Barhin effect, what is Barhin effect? Here it says that some cases of left ventricular hypertrophy. So, in cases of left ventricular hypertrophy, there is increased A wave in the right atrium. So, there is pressure increase in the right atrium, and this is known as Barhin effect. Now, what is canon A wave? Canon A wave is due to C for canon, C for complete heart block. So, complete heart block, junctional rhythm, AV dissociation with ventricular tachycardia. So, canon A wave. Now, in which condition is absent A wave? A means atrial contraction. So, atrial fibrillation. Atrial fibrillation, absent A wave. Now, what is CV wave? Systolic, that is known as systolic waves in TR tricuspid descent. Now, slow Y descent. धीरे धीरे जाएगा Y descent. Tricuspid stenosis, there is slow release of blood, stenosis. So, this is slow Y descent. Now, last year question asked about that which this wave is diff in constrictive pericarditis and pericardial tamponade. Constrictive pericarditis and pericardial tamponade. So deep X and Y descent. So deep X and Y descent is due to constrictive pericarditis and pericardial tamponade. So these are the things about the JVP. So see, these are the most important in CV cardiovascular disease. So whenever we come across the patient coming with left ventricular failure or some other problem, so you must see the jugular venous pulse. So this is the flavogram and A, C, B, X, and Y descent. These are the important. So this is the jugular venous pulse. Now, some canon A wave, it is the hallmark of atrioventricular dissociation. This is important. Canon A wave, hallmark of AV dissociation, that is atrium are contracting against a closed tricuspid valve. This is important. So, which is the jugular venous pulse?
Okay. Okay, we can discuss more in future. And
Okay.
like medicine, most of the topics in the cardiovascular system, then again in system wise we can do, and then we can go through all the symptomology of a particular symptom. So,
Yeah.
okay, Papa. So we'll continue from the next class.
Okay.
Okay.
So
We'll,
next class we see the different types of arterial pulse,
hmm.
heart sounds, abnormal heart sound, and murmurs.
Okay.
And finally, we some about the facts about ECG, electrocardiogram.
Okay.
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 Okay.